Which of the following describes ectopic pregnancy? A. Implantation of fertilized ovum outside uterine cavity. B. Implantation in uterine lining. C. Fertilization in fallopian tube. D. Pregnancy with twins. Correct answer: A. Implantation of fertilized ovum outside uterine cavity. Ectopic pregnancy refers specifically to implantation of the fertilized ovum in any location outside the uterine cavity. What is the most common site of ectopic pregnancy? A. Ampullary region of the fallopian tube. B. Ovary. C. Cervix. D. Abdominal cavity. Correct answer: A. Ampullary region of the fallopian tube. The ampullary region of the fallopian tube is the most common site, accounting for about 70% of cases. Which of these is a non-tubal site for ectopic pregnancy? A. Isthmus of fallopian tube. B. Fimbrial end. C. Ovarian. D. Ampullary region. Correct answer: C. Ovarian. Ovarian ectopic pregnancy is a non-tubal site, unlike the others which are tubal sites. A major infectious cause increasing risk for ectopic pregnancy is A. Endometriosis. B. Pelvic inflammatory disease. C. Infertility. D. Cigarette smoking. Correct answer: B. Pelvic inflammatory disease. Pelvic inflammatory disease, especially from Chlamydia trachomatis, is a significant infectious cause that leads to tubal damage, increasing ectopic pregnancy risk. Which lifestyle factor contributes to risk of ectopic pregnancy by reducing tubal ciliary notion? A. Cigarette smoking. B. High caffeine intake. C. Alcohol consumption. D. Obesity. Correct answer: A. Cigarette smoking. Smoking reduces ciliary motion in the fallopian tubes, impairing the transport of the fertilized ovum and raising ectopic risk. Which symptom is part of the classic triad of ectopic pregnancy? A. Frequent urination. B. Fever. C. Headache. D. Abdominal pain. Correct answer: D. Abdominal pain. Abdominal pain, especially sharp and one-sided, is part of the classic triad along with amenorrhea and vaginal spotting. Signs of tubal rupture may include all except A. Sudden severe abdominal pain. B. Hypotension. C. Pallor. D. High-grade fever. Correct answer: D. High-grade fever. High-grade fever is not a typical sign of rupture. Signs typically relate to hemorrhagic shock like pain, hypotension, and pallor. A key diagnostic indicator on transvaginal ultrasound for ectopic pregnancy is A. Empty uterus with positive pregnancy test. B. Thickened endometrium. C. Multiple gestational sacs. D. Liver cysts. Correct answer: A. Empty uterus with positive pregnancy test. An empty uterus despite a positive pregnancy test indicates possible ectopic pregnancy. Methotrexate therapy for ectopic pregnancy is contraindicated when A. Beta-HCG is less than 5,000. B. Patient is hemodynamically stable. C. Fetal cardiac activity is present. D. Ectopic mass is less than 3.5 centimeters. Correct answer: C. Fetal cardiac activity is present. Methotrexate is contraindicated if fetal cardiac activity is detected, as it requires no viable fetus. The preferred surgical option to preserve fertility in an unruptured ectopic pregnancy is A. Laparoscopic salpingostomy. B. Laparoscopic salpingectomy. C. Hysterectomy. D. Oophorectomy. Correct answer: A. Laparoscopic salpingostomy. Laparoscopic salpingostomy removes the ectopic pregnancy but preserves the fallopian tube. Emergency management of ruptured ectopic pregnancy includes all except A. Oxygen administration. B. Prepare for surgery. C. Administer methotrexate immediately. D. IV fluid resuscitation. Correct answer: C. Administer methotrexate immediately. Methotrexate is not used in emergencies with rupture. Surgery and supportive care are required. A nursing responsibility for patients with ectopic pregnancy is A. Encouraging heavy exercise. B. Monitoring vital signs closely, C. Ignoring emotional support, D. Allowing oral intake before surgery. Correct answer, B. Monitoring vital signs closely. Monitoring vital signs is critical due to risk of hemorrhage and shock. Which is a common complication of untreated ectopic pregnancy? A. Placenta previa, B. Gestational diabetes, C. Preeclampsia, D. Tubal rupture. Correct answer, D. Tubal rupture. Untreated ectopic pregnancy can cause tubal rupture, leading to internal bleeding and shock. Which of the following is not a risk factor for ectopic pregnancy? A. Lung infections, B. Previous pelvic surgery, C. Use of assisted reproductive techniques, D. Progestin-only contraceptive use. Correct answer, A. Lung infections. Lung infections are not a risk factor, unlike pelvic surgery and assisted reproductive technologies. Which contraceptive-related factor increases risk of ectopic pregnancy? A. Combined oral contraceptives, B. Barrier methods, C. Pregnancy with IUD in situ, D. Natural family planning. Correct answer, C. Pregnancy with IUD in situ. If pregnancy occurs with an IUD in place, the risk of ectopic pregnancy is increased. One critical nursing intervention for suspected ruptured ectopic pregnancy is A. Starting physical therapy, B. Administering oral fluids, C. Establishing IV access, D. Providing heavy meals. Correct answer, C. Establishing IV access. Establishing IV access is vital for fluid resuscitation in case of hemorrhage. Multiple sexual partners increase the risk of ectopic pregnancy primarily because A. They increase the chance of pelvic infections, B. They cause hormonal imbalances, C. They reduce ovulation frequency, D. They increase uterine scar tissue. Correct answer, A. They increase the chance of pelvic infections. Multiple partners raise the risk of STIs, which can cause PID and subsequent tubal damage. What maternal age is considered a risk factor for ectopic pregnancy? A. Under 20 years, B. 20 to 25 years, C. Greater than 35 years, D. 25 to 30 years. Correct answer, C. Greater than 35 years. Maternal age over 35 is linked to increased tubal pathology and ectopic risk. Which of the following is not a typical site of ectopic pregnancy? A. Ampullary region of fallopian tube, B. Cervix, C. Endometrial cavity, D. Abdominal cavity. Correct answer, C. Endometrial cavity. The endometrial cavity is where normal implantation occurs, so it is not an ectopic site. Which of the following best describes why maternal age over 35 is a risk factor for ectopic pregnancy? A. Increased sexual activity, B. Declining tubal function and higher incidence of tubal pathology, C. Greater likelihood of using barrier contraceptives, D. Increased ovulation frequency. Correct answer, B. Declining tubal function and higher incidence of tubal pathology. Older maternal age is associated with degenerative changes and higher risk of tubal damage leading to ectopic pregnancy. Which patient is eligible for methotrexate therapy for ectopic pregnancy? A. Hemodynamically unstable with high beta-HCG, B. Stable with no fetal cardiac activity and beta-HCG less than 5,000 MIU/mL, C. History of liver disease, D. Large ectopic mass greater than 5 centimeters. Correct answer, B. Stable with no fetal cardiac activity and beta-HCG less than 5,000 MIU/mL. Indication for surgical management of ectopic pregnancy includes A. Small unruptured ectopic, B. Hemodynamically stable patient, C. Normal beta-HCG levels, D. Presence of fetal cardiac activity outside the uterus. Correct answer, D. Presence of fetal cardiac activity outside the uterus. Surgery is required if fetal cardiac activity is detected or the patient is unstable. Early treatment of which condition can help prevent ectopic pregnancy? A. Tuberculosis, B. Sexually transmitted infections, C. Diabetes, D. Hypertension. Correct answer, B. Sexually transmitted infections. STIs like chlamydia cause PID leading to tubal damage.
A woman with a history of which surgery faces increased ectopic pregnancy risk? A. Appendectomy. B. Tubal ligation. C. Tonsillectomy. D. Cataract surgery. Correct answer, B. Tubal ligation. Tubal surgery can cause scarring or obstruction predisposing to ectopic pregnancy. What monitoring is crucial after methotrexate treatment of ectopic pregnancy? A. Serial beta-HCG levels until 0. B. Daily ultrasound only. C. Blood glucose levels. D. Renal function every hour. Correct answer, A. Serial beta-HCG levels until 0. Declining beta-HCG confirms resolution of ectopic tissue. How many questions did you get correctly? Drop your score in the comment section below. I'd love to see how you did. Make sure to subscribe and turn on the bell notification to get notified when we drop our next video.